Open appendectomy, surgical know-how, step by step. Hey everyone, welcome back to the Everything Surgery podcast. Today, we're diving deep into a classic, the open appendectomy. Whether you're a med student, a young surgeon, or just someone curious about what happens in the OR, this episode's for you. So, picture this. You've got a patient with classic signs of acute appendicitis, right lower quadrant pain, maybe a bit of nausea, fever, you know the drill. The Alvarado score's up there, maybe a 7 or more. Sometimes, imaging backs you up. Sometimes it's pure clinical skills. Why do an open appendectomy? Let's break it down. Open appendectomy is still super relevant, especially when you're in a resource-limited setting, or if laparoscopic tools just aren't cutting it. Literally, it's the go-to when you've got acute appendicitis, perforated cases with abscess or peritonitis, failed laparoscopic attempts, adhesions, appendiceal mass or phlegmon. Sometimes you need a staged approach. Suspected tumors. Think carcinoid or adenocarcinoma. Recurrent attacks. Yes, appendicitis can come back. Let's scrub in. Step by step. Alright, you've got your diagnosis. Labs show that classic leukocytosis. Maybe the CRP's bombed. You start IV antibiotics. Ceftriaxone and metronidazole work well in most cases. Talk to the patient. Get consent. Discuss all the usual suspects. Infection, bleeding, bowel injury, patient supine, arms tucked, general anesthesia, endotracheal tube in. Time to make your move. Here's the incision. McBurney's point. About a third of the way from the anterior superior iliac spine to the umbilicus. Some folks opt for a Rocky Davis, but McBurney's is the classic. Make your 3-5 centimeters oblique. Muscle splitting cut. External oblique goes first. Follow its fibers. Then bluntly split the internal oblique and transversus abdominis. Peritoneum, grasp, nick, and carefully open. Now comes the fun part. Find the cecum. Follow the Taenia coli. They'll lead you straight to the appendix. Sometimes, it's retrocecal, hiding out. A little medial cecal mobilization and you're golden. Gently deliver the appendix with Babcock forceps. Time for the mesoappendix. Clamp, divide, ligate, protect that appendiceal artery. You need a nice, secure tie. Vicryl's your friend here, to prevent any pesky bleeding. Let's ligate the base. Crush it with a clamp. Place a sturdy absorbable suture. Vicryl 2.0 does the job, and transect distal to the ligature. At this point, you can choose. Do a simple ligation, or invert the stump with a Z-stitch if you're feeling fancy. If there's pus or perforation, irrigate the peritoneal cavity with warm saline. Drains? Only if you've got a stubborn abscess cavity. Then, close up. Peritoneum with running absorbable. Muscles reapproximate naturally. Aponeurosis gets interrupted sutures. And finish with skin staples or sutures. After the table, post-op care and pitfalls. Post-op. Keep those antibiotics running if the appendix was perforated. Get your patient up and moving early. Prevents ileus and DVTs. Diet advances as tolerated. But, let's talk complications. Bleeding from the mesoappendix or appendiceal artery can be a real issue. Injury to nearby bowel? It happens. So stay careful. Stump leaks if your ligature's not tight enough. Early post-op problems. Wound infections, especially if the appendix was already perforated. Intra-abdominal abscesses needing drainage. Paralytic ileus. And DVT pay. So give that LMWH prophylaxis as needed. Long-term, watch for adhesive bowel obstruction, rare incisional hernias, and, every now and then, chronic pain from nerve entrapment or adhesions. Wrapping up. So, even though laparoscopic appendectomy gets all the love these days, open technique is still a surgical essential. Master that McBurney incision, nail your ligation, and you'll be ready for anything, even in the trickiest situations. If you found this helpful, don't forget to like, subscribe, and hit that bell for more deep dives into surgical procedures. Drop your questions in the comments, and let's keep the conversation going. Until next time, scrub safe.